Hi everybody, this is Mandy and I'm here to tell you about my final project about hemodynamic education in the cardiac cath lab. I'm the educational coordinator in the cath lab where I work, so it's my job, along with my supervisor's job, to come up with the competencies that are required yearly from the staff. We conducted a needs assessment at the beginning of the year and tried to figure out what competencies we needed for the staff. This was basically done by an informal interview with myself and the supervisor, and then with the staff themselves. We conducted a staff meeting and asked everyone what education they'd like to see happen through the rest of the year. There was an overwhelming theme of hemodynamic basics. After realizing that the staff was uncomfortable with this topic, my supervisor and I reviewed charts that were done in the previous 6 months and found that there were quite a few errors as far as the recording of pressure waveforms and cardiac caths was concerned. This was alarming and we felt that we needed to do education. The target audience was the cardiac cath lab staff. The staff includes 6 techs, 2 nurses. 2 of our techs are new, and new I mean within the past year, and one of our nurses has just started in the cardiac cath lab about 2 months ago with no cardiac or telemetry experience. She was med-surg and IMCU. In order for her to properly care for our patients in pre-post area, we felt it was necessary for her to learn the hemodynamics as well. The newer techs just out of school needed to learn the application of the hemodynamics. For the rest of us, we have at least 6 years of experience, and one of us has over 20 years. This was basically a refresher course for us. The learning environment was very simple. We wanted it to be informal because I feel, and the staff felt, that they'd learn better if they were in their own comfort zone. We decided on using the pre-post area versus the procedure room for 2 main reasons. The first reason is the pre-post procedure area is open. It's not confined, there's not equipment everywhere, and it's actually quieter than the procedure room itself. There's a lot less white noise, and the telephones do not ring near as loudly in pre-post. Another issue was that you could control the light a lot better in pre-post. If someone wanted extra light, they could sit closer to a bay and turn on the lights. If they didn't want the light, they could just turn them off. The main reason we chose pre-post was actually the temperature. Procedure area stays around 65 degrees, which is not conducive to learning. If we were in the pre-post area, it stays around 72 degrees, and we gave the staff the option of using warm blankets to snuggle up while we present. We also felt that this needed to be an informal class discussion. I say discussion and class very loosely. We like it to be a friendly environment. I want my coworkers and teammates to feel like I'm not teaching them, but yet I'm reviewing and trying to help them. We allowed the staff to choose where they wanted to sit. If they wanted to sit in a chair, if they wanted to sit in a stretcher with their feet propped up, it didn't matter to us as long as they were there and they were engaging in the teaching activity. The objectives of our teaching were very simple. Objective number 1, after a brief review, the staff of the cardiac cath lab will be able to recognize and recite normal pressure waveforms inside the heart. Pretty simple. We need you to recognize, regurgitate values, and understand what's normal and not. Objective number 2, after a brief review, the staff of the cardiac cath lab will be able to apply the knowledge of the basic hemodynamics to identify common disease processes in the heart. Okay, you can tell me what normal pressures are, and you can tell me if they're abnormal, but what I want to know is, do you know what's going on inside that patient's heart that are making these pressures abnormal? During the teaching, I was looking at a way to make this a little bit more exciting. When you're reviewing hemodynamics, it's the cognitive domain. It's knowledge-based. There's no way around it. You need to memorize. Memorize, memorize, memorize. If you don't know the normal numbers, you're never going to succeed in the cath lab. After the staff memorizes and repeats, that's the basis of the cognitive domain. To make it a little bit more challenging, I decided to go with the affective domain. The affective domain focuses on feelings and application. For this activity, we went with case study review and role playing. The case study, I actually pulled pressure recordings and a cath report from a patient that we had done a procedure on, of course following all HIPAA rules and getting rid of all of the patient information. We looked at the waveforms and we discussed normal values, abnormal values, and attempted to figure out what was going on in this patient's heart. It actually turned out quite well. The staff enjoyed it, and I feel like they've learned something. My teaching strategy was very simply lecture. I made a PowerPoint, which is attached, and after the lecture, we attempted group discussion. Group discussion was very informal. We had this staff ask questions, help teach each other, and after that, we went to the role-playing / case study. The case study, as I said earlier, we reviewed the pressures and diagnosed the patient's disease process. The evaluation method was very simple. We did a very informal Q&A after the lecture. I wanted to know if the staff actually had any questions, if I taught appropriately, or if they were just generally confused. Hemodynamics can be very confusing. It's a difficult concept, and it's one concept that usually takes years in the cath lab to master. Because we needed an actual qualitative and quantitative measurement and an immediate measurement, if the learning was effective, I unfortunately had to administer a quiz. I do not like quizzes. I will put that out there, but I felt that it was appropriate in this situation. In the long term, my supervisor and I discussed that we should probably do a quality analysis of charts later on down the road. In a couple months, I'm going to pull patient charts from the computer system and look over the hemodynamic waveforms and the interpretation of the waveforms by the staff. If it appears that the staff has gotten better at interpretation, I know that my teaching has been a success. Most importantly, after the lecture, the quiz, and the role playing, I'm going to sit down and ask the staff how I did. I want to know if I'm a fun teacher, if I'm a boring teacher, if I can explain things appropriately, if they learned what they needed to learn, or if they need to learn more. I want this to be a very open and honest discussion with my teammates. In the cardiac cath lab, there is one very obvious barrier to learning. That barrier is lack of time. The cath lab can change at the drop of a hat. We can have no cases scheduled the day before, come in and have 5 procedures to do. Time is one of those things you just have to work around. We had planned to do this presentation for over 2 weeks until we actually had a day that it would work. You just have to keep plugging along and do it when you can. Another barrier is lack of support of education from upper management. I don't want to go into too much detail of this, but upon a management change, it was decided that I would take over educational coordinator because education can no longer slide through the cracks in our department. I actually am honored to be taking on this task, and I overcame the barrier of lack of upper management by actually sitting down with my upper management and explaining to them the importance of education. Yes, they already knew, but I think they needed a little bit of a reminder. Another barrier is the teaching environment. If you're in an environment that's stiff, informal, not welcoming, unfriendly, you're not going to pay attention and you're not going to learn. You're just going to leave. And I think the final barrier that we all have to be cognizant of during teaching is literacy. A lot of people think of literacy with the patients. You also have to think of literacy with your staff. A great example is the RN that just started in our cath lab. She has 12 years of nursing experience. That, to me, I would think that she knows everything. I could ask her any question about the heart and she'd know the answer. That is completely the wrong assumption. She is literate in med-surg nursing. She is not literate in cardiac. That tells me I need to dumb this down, quote unquote, so she can understand a little bit better, because this is the first exposure she has had to hemodynamics.